Asthma is the ultimate self-help disease. You are the most important member of that healthcare team. Unfortunately, tens of thousands of patients with asthma are severely undertreated, causing countless hospitalizations and many unnecessary deaths, as we found out from Dr. Elliot Israel at Boston's Brigham and Women's Hospital, a nationally ranked center of excellence.
If you're constantly having attacks and constantly having to use your reliever medication, that means your asthma is not under good control.
First and foremost, asthma is an inflammation of the lungs. As the airways become more inflamed, they begin to close. They're also much more sensitive to triggers, which can also make them begin to narrow down. That means the fundamental therapy should be to fight the inflammation. It's called controller therapy, such as inhaled corticosteroids.
One of the real principles of controller therapy for people who need controller therapy is part of the problem is people take medications until they feel better, and then they'll stop thinking that it's kind of like an antibiotic. I got over my pneumonia, I got over my cold. But the asthma hasn't really gone away.
And that's where many asthmatics get it wrong. They use a medication to open the airways called a bronchodilator, which may work temporarily while their lungs get more and more inflamed and their basic disease worsens.
When we look at patients who are using their reliever medication many times a week, those are the patients that are more likely to go to the hospital. Those are the patients that are more likely to be hospitalized, even end up on a breathing tube, or even dying.
The hallmark of asthma therapy is to know when you're getting into trouble and to have an action plan.
The use of action plans or a co-management plan in terms of treating your asthma can really have benefits for patients in terms of not having to go to emergency rooms and not being hospitalized.
Here's a typical action plan which you put into effect as soon as you begin getting into trouble. Now, the specifics of this plan you really want to go over with your own doctor. Start inhaled corticosteroids at a high dose if you're not taking them regularly. If you are taking inhaled corticosteroids, double, triple, and even quadruple the amount of inhaled steroids you're taking. Take your reliever medication for symptomatic relief. But if you're not getting relief, call your doctor or go to the hospital.
We know that patients that participate in those type of plans are able to reduce the times that they have to go to the emergency room or get hospitalized by much more than half.
We've seen there are two fundamental kinds of medications, relievers and controllers. The inhaled steroids are the most powerful controller medications. Less powerful leukotriene modifiers are available to take by mouth. Here's how you should know you're getting into trouble. You're using reliever medications more than a couple of times a week other than to prevent problems with exercise. You're waking up at night because of asthma. There's more shortness of breath going upstairs. Your exercise becomes limited, or you're limiting your activities. Now, things are getting really bad if you can't complete sentences without catching your breath. You get short of breath with your routine activities. You're using your inhaler every couple of hours. If your asthma is difficult to control despite regular use of controller medication, you should talk to your doctor about other conditions that might not be recognized that can make asthma hard to control. These include unrecognized problems with your sinuses or unrecognized gastroesophageal reflux disease, which we would know as heartburn. Properly managed asthma is an illness that's always there but should not interfere with a full active life. Have an asthma action plan that works.